Hey, my coding family, how's everybody doing? Good to see everybody. Make sure I got these settings right. Let's see if you guys can hear me. Yes, I think you guys can. Let's see if you guys can see the screen on both. Trying to stream on TikTok and YouTube at the same time. How's everybody doing? Happy Easter Monday, I guess I should say. I hope everybody had a great Easter. I wasn't feeling well Friday. I got a hold of some bad pizza on Wednesday, and it took me a few days to get over it, but by Sunday I was feeling better. Mom had a flat tire today, so she got stranded in her escape, and that was a bit of a drama today, so I had to postpone today's live for a couple of hours to get that taken care of, but everything else is going good. I hope everything's going good with you guys. I wanted to show you a couple of little handouts that I made for my class for medical coding, the ones that insisted on getting a CPC course, and then they wanted me to be their instructor. This is one that I made for our ICD-10s. They have a question that sometimes is on the exam, is like, why do we even use medical coding? What's the reason? And there's like A, B, C, or D. This is what A, B, C, or D is, which is tracking public health, health management, insurance and billing, and then quality and guidelines. So if you're asked this question on the exam, which one is not the reason why we use coding or are in even medical coding, you know what the 4 bullet points are with this little handout from right here. So that's kind of handy. Another one that I made for everybody in my class is the layout of the ICD-10 book. You know, we have 4 indexes in the front of the book. Not only do we have the alphabetical index, but we have got the table of neoplasms, the table of drugs and chemicals, and the external causes. But I wanted to make sure that people knew that sometimes we can have letters and numbers mixed in, that an X is a placeholder, and that sometimes you can even tell what the answer is with your ICD-10 codes just by knowing a few little tricks, like the first alphabetical letter in the ICD-10 code is the class, which is our chapter headings in our ICD-10 book. We've got 21 of them, 22 of them, I think. Sorry. And then if you have the second and third digit will be your site. The 4th digit is the severity. The 5th and 6th digit could also be severity or laterality, like right, left, and bilateral. And then the 7th character of the ICD-10 is like the encounter. Was this the initial encounter, subsequent encounter, late effect encounter, that kind of thing. It can also mean a severity or a type of fracture. But what all that means and how it means something to you for the medical coding certification exam is that what is really, really cool is that if you were to look at these ICD-10 codes, you would know right away that all you'd have to do for these first set, the H set, is know if you're right, left, or bilateral, because that fourth digit, like what I said up here about the side, right? This is actually the fifth digit. Sorry, guys. Can't count today. The 3 always equals always, and you don't get to say always in medical coding very often, but that means bilateral. The 2 equals left, and then the 3, the 1, equals right. So if your documentation in your exam question said your patient had right pain of the ear, you know your answer has to have a 1 in that fifth digit. And knowing that for the exam is super handy dandy, because you don't have to go looking up every single code, getting down to the fifth digit and looking it up if you actually know those by heart, which isn't too hard to do. Another area where up here at the top where I said in this thing the severity is at the fourth digit, this is where this comes in handy for something like this depression codes, right? So 0 equals mild, right? 1 is moderate, and then the 3 equals severe. So if this one had mild depression, right, or moderate depression, or severe depression, you know what the answer is just by looking at your available answers. If that fourth digit is in those 0, 1, and 3 areas, you know already what the answer is. It can come in real handy for your exam questions when you're looking at just the answers. Anyway, I just thought that was super cool and something that we learned this week in my medical coding course that I'm teaching for the first time. I feel like I'm doing a horrible job at teaching this stuff, but it'll get better with time, I guess. But some of this stuff is kind of cool, and I thought I'd share with you guys. Let me catch up with the chat and make sure you guys are hearing me and that I'm not missing anything. Hey Cynthia, good to see you. Hey Angela, Tarantino, Cheryl, good to see you. Portman, good to see you. Hey Gail, hey Marcy. Didn't you pass this week, Marcy, or am I just dreaming? Hey Cynthia, good to see you. Gupta, good to see you. I have a question. Can I use my 2023 books to give CPC exam for 2025? No, not technically. Now, if I've never seen one of those online proctors even look at my books. I mean, they made me shake them out in front of them, and but I've never had them read the front of my book to make sure I had the correct book in year and time. Now, if I had a 2023 book, do I think they would notice? No. But AAPC technically wants you to take and utilize the 2024 or the 2025 book. If you're doing ahimas, CCS, or CCA, they are requiring 2025 books. But honestly, I don't think if you're doing AAPC, I don't think anybody's going to notice. But, you know, there is a chance you could get turned away if you don't bring the correct version of the book with you. I know there's somebody on eBay that has 2024 and 2025 versions of the new AMA CPT book, and even the 2025 version is going for like $69 with free shipping. So you can find some pretty good deals right now since the book has been out since October right now. Hey Royal, good to see you. Hey Coding Fam. Hey Lori. Bill, Lyons, Davis, Miss Kenesha, good to see you. How's those practice exam questions coming? I have a few people that I'm practicing sending email daily practice exam questions to, and they are testing it out. If the system works pretty good, I may open that up to more people. We'll see. Hey Davis, Austin, Lindsay, good to see you. Can you use the study guide book on the exam? Nope, but you can use it and put stuff inside your CPT book, your ICD-10 book, and your HIPICS book from your study guide into those books and use it. Yay, I'm glad you can hear me. Speaking from experience, you are awesome. Aw, thanks, Portman. Not till July, Marcy. Okay, well, I keep thinking you've passed for some reason. Thanks, Go-Kart. Hey, Austin. I'm glad you're here, too. And TikTok's going off. Hey, Happy. Are you going to do another workshop? Yes, this Saturday. I teach my course on Sundays now, so this Saturday will be another workshop for you guys. I was working on all the questions. I think I've got 100 questions for this Saturday. It's going to be totally free for everybody, so you do not have to pay for it this month because it is my birthday month, so it'll be totally free. The replay will be available on YouTube, but if you want to join in live with me, I'm going to do it Saturday at 2 on YouTube. We're going to do 75 to 100 questions in 3-hour time frame from 2 o'clock Arizona time zone. So right now it is 5:10 here in Arizona, so that will tell you what time it is in your area when I'll get started. And the replay will be available for you, but it's going to be a mock exam. We're going to do questions from all 18 areas of the certification exam. It's good for CCS and CPC. And if you are wanting to see if you're ready for the exam, then bring your 3 manuals, the CPT, ICD-10, and HIPICS, and then do the questions with me in the same pace that I do them. And if you can keep up with me, then we'll be good. I have this new exam maker that pulls from a ton of questions, over 1,000 questions, and it will create an exam for us so that I don't get to see a lot of the questions ahead of time. So that way I can truly do them 100% live with you guys, and I'll show you what kind of pace you need to be in and where to find some of the answers. Thank you, Kenesha. All right. Do the CPT ebooks have all the out-of-sequence codes read easier to find than in the books? Yeah, I believe so, because if you're in the ebooks, the out-of-code sequences don't bother you because you use the search feature to find CPT codes instead of flipping through a book to look for them. You just type in the code number and it brings up every time that code was mentioned in your book. So I think so. So again, just to go over just a little bit for these 2 things, be sure you know why we even do ICD-10 medical coding, why we convert words to numbers. It is to track public health. It is for health management, take care of our patients. It is for insurance billing, of course, and for quality measurements and guidelines. And if you understand the breakdown of the structure of some of the ICD-10 codes, especially some of the differences between the 5th and the fourth digits, knowing that the fifth digit, if it's a 3, means bilateral. If the fifth digit is a 2, it can mean left. And then if it is a 1, then it means right. That will help you during your certification exam, picking out the correct answer a lot. Another one is your fourth digit means the severity of whatever illness, right? So if we have differences between mild, moderate, and severe in disease progression, that fourth digit can be super helpful in picking out the correct answer without looking them up. That is super cool to know. All right, let me get these separated a little bit better. And let's start with this question. Ooh, this is a really good anatomy question. Anybody know how many of these do we have in your nasal cavity? Let me check up with chat on TikTok and see what I missed. Sorry guys, it's hard to keep up with all the chats from both devices, but I am live on YouTube. If you are looking for a better view, you're actually going through a cell phone to a computer screen, which is in OBS, but if you want a direct screen from my screen to your screen, you can go to YouTube. I am streaming there. I will be having a contest in a minute to give away 5 YouTube memberships. So if you happen to be inside YouTube chat, there is a chance you could win some of my video access too. Hey kitty kitty, good to see you. Hey Twinkle. She's out there giving gifts again. I'm gonna have to put her in timeout. Hey Island Mountain Girl, good to see you. You too. Thanks for the heart me and the subscription. Elena, you are awesome. Thank you so much. And all the roses she gave. Wow, thank you. Hey Sunshine. Sorbet, I love that. I love sorbet ice cream too. Is that only in H codes? No, it's just for an example. Any kind of diagnoses that actually have any kind of bilaterally, it is for any sections. The ears, the eyes, what arms and legs, knees and elbows, you know, those kinds of things. Anything that's bilateral or has a right or a left will have that commonality right there. It's just really cool to look for. Same thing for any diseases that are classified by mild, moderate, or severe. Y'all can put in chat what you think the answer is. Do we have 2, 3, 5, or 6? Destiny, thank you for the heart me. Mine did. You can with the 2024. What study guide? I would like to get one. So let me see. We've got 24 people on YouTube and 12 likes. Thank you so much, guys. See if I can't add this. Window capture. And, yep, if you go to my website, medicalcodingbyjen.com, and you go to the shop, I can save you like 20 bucks on this study guide. It is AAPC's study guide. Let's see. Yep, there it is right there in the inside my shop. It's the CPC study guide. It's the official one. It's a printed copy. It will come in the mail to you. It comes with, I don't know, all kinds of stuff. Practice exam questions, all the chapters. Each chapter has 10 review questions. They say a 200 question exam at the end. But this study guide is what they have. online or even on Amazon, I think it's what, $150 or $149. So I get a little bit of a discount with the teacher discount. I can get it for this much from AAPC and then have it shipped to you. I still have to pay for shipping on top of it, but and tax, but it still saves some money off of the thing. And even AAPC will charge you shipping. Amazon just is the only place that doesn't charge shipping. But I think we're $50 off of what AAPC charges. So you can go there and get it if you want it. There may be other places to get one that's used, somebody reselling it or something like that, but that is kind of handy dandy. Everybody got the answer to this question. Let me get back to it. Did I see anybody with the correct answer? I'm on chapter 8 with the AAPC CPC certification, having a hard time knowing when to use modifiers. Summer, you use modifiers when you need to change the CPT code descriptor only. So, if you're paying for anything, an x-ray of a leg, right? If your hospital did not hire a radiologist to read the report, but they're going to send the films electronically to a remote doctor on some island somewhere with his toes in the sand, and he's going to read that report somewhere else, and then that report will get sent to the provider who ordered it, then you know your facility will only charge for taking the films and not reading the report and sending the report. That means you are splitting up that CPT code descriptor, because the CPT code for an x-ray of a leg includes a report, everything that you need. It's got everything in it. It's the x-rays, the film, the storage of the films, the reading of the report. It's all into one. But if you need to break that up, and you know a physician is going to charge his fee for reading the report somewhere else, and they're going to bill separately, and then your facility is just billing for taking the films, then that's when you add the 26 modifier or the TC. TC is for the building, for the x-ray, and then 26 will be for that doctor billing for just him reading the report. Same thing with any other reason why you would add a modifier. If you are doing 2 child codes under one mama and you mean it, then you're doing multiple procedures, right? That normally would not go together. So you need to add your 51 modifier to it. If you're doing a procedure that is clearly marked as singular, but you need to do it twice because you're doing it bilaterally, then you're going to add a modifier. You only add a modifier when you need to change a CPT code descriptor. So that is super helpful. The answer to this question is 3. Did everybody get that one right? That one's a harder one. All right. What do you guys think is the answer to this question without looking at the question? If all you had was 1 CPT code and then 3 diagnosis codes, is that normally an answer? Or would it be 1 CPT code and 2 diagnosis codes? Or would it be 2 CPT codes and 3 diagnosis codes? Just think about it that way. Look for your coding irregularities, coding similarities, and just play around with it. What do you guys think might possibly be the answer? Or at least get it down to just 2 answers you think it might be. While I catch up with chat, I missed like 31 messages here. I feel like the study guide is confusing me more. I don't know if I will remember it all. You don't need to remember it all. You just need to read it once and do the practice exam questions and move what you can't remember into your CPT book. You would like to join? That's awesome. Thank you, Jennifer, for the happy birthday wishes. Do you have any examples for CRC? I do. Inside my shop on my website, if you just type in CRC, you'll end up with a workshop that you can purchase the replay of and all of my notes that are for the CRC exam. For the ICD-10 book, you can purchase those 2 things and you should be able to pass the CRC certification exam. Can we print the questions out on advance? I mean, if you want to kill trees and print questions, you can, I guess. Depends on where you get them from. But not for Saturday. No. This is supposed to be a mock exam, Jen. So when you show up for your medical coding certification exam, they're not going to give you the questions a day or 2 ahead of time and let you print them out and then go find your answers ahead of time. You're going to have legitimately 120 seconds per question to go find an answer. And these are going to be blind questions that you've never seen before. That is the purpose of my workshop on Saturday. It's for all of us, including me, to show up to 100 questions, and we start at 120 seconds per question and get going and see if we can't do the exam, the mock exam, in the same pace as the certification exam. The only way you will know if you're ready for the exam is if you show up for a mock exam and you do it for several hours without a break, and you can manage to answer the questions in 120 seconds per question. You will not have the luxury of having those questions ahead of time on the certification exam. So, nope, no advanced questions, and you don't get to have the questions after the workshops either, unless you just watch the replays. I have 3. Good job, Mountain Girl. Good job, good job, good job. 3 pairs or 6. Huh. Good job. Do you condense, include all of the same info? Yes, I do have a condensed version of their version of the study guide if you want it in my store. Yep, I sure do, Liv. Thank you, Jen, for all you do. Thank you for clarifying the questions. You're welcome, Life Today. You're welcome. No worries, Summer. I just found your page, and I'm about to complete my medical coding and certificate classes. Excited. Awesome, CC. So happy. What about OBGYN? Love OBGYN. I delivered babies for a long time in my clinical career. Brought it. That's why I was wondering. Yep. That's awesome. All right, YouTube. I'm back to you guys. Everybody saying B and C? Well, remember that sometimes, and a lot of times, the answer is the cheapest of the 2 CPT codes. Of course, it's probably not going to be D because this has 2 CPT codes. And they're probably just trying to trick you into billing both. But then out of these 3, the cheapest of these, just numerically, because we've got 333, 222, and then the 4 and the 5, well, that 1 is probably the cheapest procedure. So I'd be curious about A or B, but we can find out what our headers are first. What's our headers for 32100? Does anybody know what the headers are for 32110? I'm looking for a blue header and a red header. Anybody know what? Will you be teaching an instructor-led on OBGYN? I'm teaching an instructor-led class right now on all 22 chapters of medical coding. OBGYN is going to be in there, yes. I haven't gotten to that yet. Wednesday we're doing chapters 12 through 22 of the ICD-10 book. Then Sunday we're doing hip picks and modifiers. And then Sunday of the next week is going to start our CPT coding. And then we'll go through each chapter. OBGYN will be about 7 in or so. So our red header is lungs. Our red header for 32100 is lungs, plural, pleura, and we're doing an incision is our headers. The 32484 is under the header of lungs, plural, but it's under removal. 2503 is also under the same thing, under removal. And our 21602, I mean, in case you want to look it up, but I know we didn't do 2 of those, but 21602, 21602, 21602. Ooh. That's under the header of trach and bronchioles, and the procedure is also an incision. If you can't go look at the red and blue headers first, before you look at the CPT codes and their descriptors, then you probably won't pass the exam. If you can start adding in the pit stops of looking backwards for the big, bold, red body part, and then also what blue headers you're under, first, before you look at CPT code descriptors, that will make a big difference. So, all I did with these available answers was go to the red and blue headers before each of these CPT code descriptors. I'm not looking at the CPT codes yet. I'm only going to the red and blue headers. First thing I'm going to figure out, am I in the trachea and bronchioles, or am I in the lungs or pleural? That will get me down to a 75% chance of getting this right. So you can see right away we're in lungs. We're not in the trach or the bronchioles. So like I said, D goes away. And see how those red headers help you decide that? Now, are we doing an incision or a removal? What are we doing? Meow, meow. My cats are crying. thoracotomy, thoracotomy. Which answer is the only one under thoracotomy? These two removals are under PNEUMO otomies, where this one is in the thoracotomy area. And that's still not technically looking at the individual CPT code descriptors. That's just mainly looking at their overall major header of those sets of codes. What you group together, when you group these codes together, those are under the pneumo, and then this one's under the So the cheapest procedure was the correct one if you got rid of the combo code, because that's not the cheapest by the time you add two CPT codes. Yeah, but that one is the cheapest procedure. You're in a coding class? I do tutoring. I do individual tutoring where you can do a mock exam with me and see if you're ready for the exam, or you can just book, you know, an hour long, I want to ask you a bunch of questions thing. Or you can now add me to your course as your instructor if you want me to teach you all 22 areas or whatever of the certification course. You can add a 12-week tutoring if you want to. It's all on my website. Go to Medical Coding by Jen. It's all there. All right, guys, what do you guys think about this question? If you were looking at it and trying to figure out what is the correct answer without looking at any of the question, what do you guys think? We've got all three of them, or all four of them, start off with the same answer. So don't have to worry about that. Then we've got two of them that are in the 56 area, and then two of them that are in the 55 area. And then we've got two of them in the 51 area, and then another one that has the 50 again. Would we have a 50 coded once, and then in the same billing cycle for that day, would we bill it again later on after we build another CPT code? Or does that look like a coding irregularity? And then we've got D over here with 53. That looks like a coding irregularity to me. We wouldn't do that. Let's go look up our 51 code, see if it's an each. If it is, then we might be able to times it. If it is not an each, then we know that that is a coding irregularity. 328. And by each, I mean the actual word. 328. 51. So that is for a lung transplant single without bypass So that is for just single. If we had double, we have a code for that, which is the 32853. So we would not times that code. So A is a coding irregularity. We would never times that one. What's the difference between B and D is either our 56 or 55, or since we're already here, the 51 and the 53, they're super close together. Would we be billing our back bench, or would we be billing for a lung transplant? That's the only difference between B and D. So let's look through our question and see what we're doing here. What is the correct coding for physician A? Preparation. B, an insertion, and then physician C of the lungs. What did C doctor do? C doctor did into prepped and waiting patient by the physician. If that's too hard, we can look at our 55 and 56. That's just unilateral or bilateral too. 55 is unilateral, where 56 is bilateral. This one right here and this one right here. So how many lungs do we have? From beginning to end, we had bilateral, both lungs. We would never have anything that's going to have a single lung in it anyway. So without even knowing what backbench or the lung transplant difference is in B, we know that B cannot be the answer because it is only unilateral. The only one it could be has to be D, because that's bilateral. And this is bilateral too. Very cool question. I like that one. All right, you guys answer this one without my help while I check up on chat and see what I missed. Did everybody get that one right? Shoulder pain is a giveaway. That's awesome. Good job. Karen, sorry if I missed your message. Red header, lung and pleural, blue header, incision. Good job, Kanisha. I can't really determine without reading the question. How do you know what you're coding without seeing what the procedures and diagnoses are? We're just playing around with the process of elimination, because the main thing you got to become is really good exam taker for the certification exam. That technique of being a really good exam taker is super helpful. Does the numbers 1, 2, 3 associated with right, left, bilateral, and unspecified only apply to ICD-10? Just relax. Oof. I don't know. I'd have to audit the CPT code, like with this question that we just did right here, where the 56 is bilateral, but the 55 is unilateral. Are unilaterals always an odd number, and then bilaterals are always an even number? I'm just curious. I don't know. Does CPT fall in the same line as ICD-10 in that sort of pattern? I'd have to audit and see, but it is a cool question. I don't know yet, off the top of my head. Yeah, that was a tough question. Everybody's saying C on this one. Indeed. Cardiomegaly. Good job. Perfect. All right. Another guess one here. Let me give away some YouTube memberships. So while you guys are guessing, I am going to give away some YouTube memberships. And I think somebody joined. Let me send YouTube some money, $26.85, and give away 5 YouTube memberships. You guys will enjoy the perks of having my podcast where I'm reading out the guidelines to you in ICD-10 and in E&M CPT. Kanisha, good job. She won. Mabel, Tasha, Patrice won, and Natalia. Yay, guys. That's awesome. I hope that is super helpful. You guys having access to all the old workshops now for 30 days too. That's an excellent way to practice for your certification exam, is to having access to, 4 years worth of my workshops. If they're older than 90 days, then you've got access to all of them, and you can just start them and then practice and see if you can't get all those correct. That is super helpful. All right, for this question, let's see, what do we think is going to be correct? I definitely don't think we'll add radiology. A lot of times they'll ask these questions and we don't need radiology because it's already included in your CPT code. So the cheapest of these 2 codes that are left in C and D is just C, because C is a 1 or 2 would be more difficult. So it'd probably be C. It's just me guessing. Anyway, that's how I would do the process of elimination. And if I wanted to just pick an answer and not read the question and move on to the next question and see if I could pass the exam this way, this is how I would do it. This is how I passed my instructor exam. I was trying not to pass because I wanted to see the exam twice, but I just played around with the process of elimination and, see what works. It's too fun. I love playing with it. All right, guys, so our differences between our 36222, let's go look. 36. Three, 6, 2, 2, 1. If you notice inside its CPT code descriptor, it does say all associated radiology supervision and interpretation is included, including an angiogram, all kinds of stuff. It's included in everything. The only difference is, are you in an aorta or are you in an artery? The 21 is in the thoracic aorta, where 22 is in the common carotid or inaudible. So what is our placement? Where are we at? We are aortic. And the 21 is non-selective, means we go in and we stay put there. I just read that the ICD-10 code 5th and 6th character is right, left, bilateral, 09, unspecified. Yep. Isn't that awesome? Yep. So at the beginning of my lesson, I made you a little chart that says that information, right? And then also your 4th or 5th digit could be, again, 0, 1, or 3 for mild, moderate, or severe, which is really cool when you're dealing with conditions like depression or whatever that go from mild, moderate, severe. We've got a lot of diagnoses that do that. So just knowing those kind of characteristics is super helpful. Just even knowing what S stands for, or C stands for, or the K is for your tummy issues. Just knowing that first letter in your ICD-10 is super helpful. Also helps build your confidence during these coding exams, that you know that you are correct when you find stuff that match like that. So the only difference is aortic. We are aortic. All right. Out of these available answers, what do you guys think would be the correct answer, just based off of patterns, norms, that kind of stuff? We have 3 of them that are all in the 368 area, and only 1 in the 369 area. Is there a difference between the headers in those? Let's see. 368 is under what header? 368. 36825. All right. What header are we under? We are under hemodialysis. What body part are we under? And hemostasis. Our 369 is under what header? We're introducing something to get rid of something, and then hemodialysis is our other area. What did we do today? Let's check out our question. Which one is for a revision of a fistula, so that the patient can continue with hemodialysis? We didn't do hemodialysis today. So I think all these codes that are under the 368, they're all under the hemodialysis, right? Area. Dialysis circuit, any method. Could be. I'm dealing with the access ports. Sorry, somebody's knocking at the door. I'm seeing if Travis is going to get it. I think he is. All right, where are we at? 369, which one is a revision? Should be in the very first part of the CPT code descriptor. 369. We didn't create one. Revision is our 32. Our 31 is also a removal, but not the revision. Yeah, like our 32. It's the one in the middle, huh? B. And then our 6904 is just a percutaneous removal of a blood clot machine-wise, but all we did was revise one, so that's got to be our B32. Just look for that revision. That one was easy. Alright. If we were looking at the 4-4s, we got two that are in the 4-4-1s. Let's go look. 4-4-1 is what? 4-4-1, 40? What header are we under? We're under, this one is under C-O-L-E, and then 442. Yep. 10. Same thing, but we're under excision with this one. The 4140, our blue header, is also under excision. Unhelpful, both headers. But our 442s are under the laparoscopic excisions, where our 441s are under just plain excisions without the scope. Did we use a scope or not? That will be helpful. Which one is Hemi? our cheapest of the procedures, of course, is A, 140. It's a partial. What's another word for partial? Ooh, my TikTok is wanting me to do the puzzle piece. Let me make sure I get that done. Uh-oh. Alright, let's do it again. Okay, there we go. Yeah, there's a better view on the YouTube channel. I don't know why. It's like so fuzzy. If you don't know, you can always look at your diagnosis codes. Would you be a C code or would you be a D code? Knowing those differences is super handy dandy. Another word for partial would be hemi, right? So the only one it could be, as of course our cheapest one, is A, right? Yep. But it doesn't say that near the CPT code descriptor, so writing that in next to your 44140 is super helpful because they don't have the word hemi there at all, and that would be nice to have. Thank you for the 28,000 likes on TikTok. You guys are crazy. Hemi. Thank you so much. That is cool. How many do we get on YouTube? We got 24 likes and 32 people on YouTube. That's awesome. All right. Let's Gucci. If we were looking at these R codes, which one do you think would be correct? Would we have 3 diagnosis codes, 2 or 1, typically for AAPC? You know, if I was just guessing, I'd get rid of all of the answers that have R's in them because they're just symptoms, right? And the only one that has a real diagnosis code is C. But that's just playing around with process of elimination and looking for similarities and knowing what they normally look for in an answer. Yep. What do you guys think about? Yeah, in the previous question, C's were cancer. Yeah, D's are for encapsulated stuff. Yeah. Our final diagnosis is dehydration. And that's an electrolyte issue, which we went over last night in our live class for our CPC course. We did some dehydration guidelines. It matters whether they're dehydrated due to the treatment of cancer or other things, whether dehydration goes first or second or whatever. So some of those guidelines and sequencing get a little crazy, but my notes make it super clear during the exam so that you guys won't get that wrong. But this answer is C. Alright, for this question, what do you guys think is the answer? It looks like we've got 2 with the diagnosis that ends in 9 I try to avoid those. So then our only differences with an O diagnosis would be the 3 or the 4 over here as far as the CPT codes go. What's going on with those CPT codes? 495, what is that? 495, 93 and 94. Well, I don't have those codes in my book I'm looking at. I gotta get me a different CPT book. I got an old version in front of me. Oh. Gotta get a different one. I don't know why I had a 2022 book on my desk, but I did. Sometimes I like to look back at notes. I must have been doing something. Alright, 495, 93 and 94. Yep. Alright, now I got these codes. So what is our headers? Our headers. We're under repair. And what body part are we under? Gotta go pretty far. Abdomen, peritoneum, and the O word. If you look at your headers, is that what we're doing? Of course, we're doing initial incarcerated hernia. Are we under initial? You gotta go look at the mama code to see if you're right, which is 49591. Being able to go to look at mamas to see if you're in the right area is a vital skill that you need to know for the exam. The mama code for these sets of codes, the C and D, is 49613. You gotta look at these differences to tell which set of answers is correct. For sure. What do you guys think is the answer? It's not our cheapest one this time, but it is B. Our differences between these are just the sizes, right? And 4 is going to be in the 94 version. Anything 3 or less. Oh yeah, because they're incarcerated and strangled. Yeah. Greater than 10 is going to be their 95s and 96s. But, yeah. 93 is reductible. 94 is incarcerated. Our 15 is reductible. And our 16 is incarcerated, but it's under not initial hernia, it is under recurrent. This one is recurrent, and this one is initial. And you could only find that through looking at your mamas. Yep. Something like that will be on the exam, 100%. Those codes right in here will be on the exam. You will get asked a hernia question, always. All right. What do you guys think is the answer just by looking at the differences? We've got 26 modifiers. Would it be the 84 or an 85? If we go by what's cheapest, it'll be A. If it's the more expensive procedure, it's probably just C. But they're going to try to make you add the 26 modifier, but I bet you don't need it. All right, this one is a case, so I guess it's probably a couple of pages long, is why I've got it separated here, if anybody wants to take a gander at it. What's our differences between the 84 and the 85? 503, 84. Probably don't have to look for headers. They probably are under the same headers, so they're probably right beside each other, and you don't have to do the header thingy for these two. Both of them are removal. One of them snare technique. They're both snares. One of them is removal of the stent only, and then 85 is removal and replace the stent. So we just need to see, what do we go in here and do? What do we do? We know we were going to remove a stent for sure, but did we put in another one? Another stent was introduced and positioned. So we know we did the more expensive procedure. We not only just removed, we removed and replaced. So C is our answer. Yep, yep, yep. For sure. And I can't see why you would ever add a 26 modifier to this one. Because you couldn't split up this CPT code as like a doctor only reading a report and doing part of this procedure, and then another doctor going to bill, or a facility going to bill TC on this. There's just, I don't think that goes with these codes. So yeah, anyway, all right, what about these codes? We've got two of them that are in the 534 area, and then this one's in a 530 and this one's in a 541. So out of these two, D is the cheapest one, maybe, if they're in the correct order. What's going on with 534s? What header are we under? 534, where are we at? What's our headers? I love the urology section because it is easy if you pay attention to your red and blue headers. 534, 00, and 10 are under the blue header of repair, and we're only doing urethra. If we're under C and D, we're under urethra and we're doing a repair. If we're 530, we're doing an incision of a urethra. We're doing an incision. If we're 541, 61, we're under this word that I cannot say, I'm sure. And we're doing an excision. So, are we under the red header urethra is number 1? Because 3 of our answers are under urethra and only 1 answer is under that answer. So check your question. What body part are we dealing with? What's that say? What's that say right there? Now, they're doing their best to put in some propaganda in here to make you think they're doing a procedure on something else. But what did you actually do once you got them anesthetized? You went in and clamped this sucker. So be very, very careful when you're doing your word searches. We don't care about what we put a block on. What did we do once we got in there? We put a clamp on something. The skin edges were approximated. Ooh, they're trying so hard to not tell you that they did an incision. We didn't, 4110, the 4110, what did I say that was under? The 3410 was under repair. We didn't repair nothing. We didn't fix anything. That's repair. These two are repairing something. This one's just cutting something away. And so when they say that the edges were approximated, ooh, that's a good one. I'm going to put that in my notes. That goes underneath the word incision. Incision equals edges approximated. Ooh, that's fancy talk right there. All that is we cutting away some of this urethra meatiness, whatever, around the edges that are restricting stuff. Nice. That just means we cut. That's just incision. So, S-I-O-N. Fancy words. We didn't repair nothing. So it's not those two that look super similar. We did not do something with that one, even though they said the word here. We didn't fix that thing. We didn't do nothing there. What we fixed was the urethra, and we did it by just making an incision. So that is B. Ooh, that one's rough. I don't know if anybody would really get that one during a CPC exam unless you've seen that question before, because you'd be moving so fast with 120 seconds. You'd see penile and probably think 4-1, right? Mm-hmm. No one would have time to look for edges were approximated to understand that you're under incision. That's a really good question. I can't wait to get this part in school. Ah. Hey, Destiny, me neither. I cannot wait for CPT coding training in our class because I am so over ICD-10. And we got to do chapters 12 through 22 on Wednesday. And it's such a shame we spend 3 days on ICD-10 when there's only 5 questions on the exam for ICD-10. But it's important. Some of the chapters don't have guidelines you need to worry about, and some of them do, so it's nice to go over each of them a little bit individually. Oof. All right, guys. Let's do another question. Let's look at our differences here. We've got 3 of them that are in the 9-4 area. So that is all natural delivery. If your 5th, 2nd, and 3rd digits are a 9-4, that means you had a natural delivery, and I can't say the words, right? If you're a 9-5, then you had a C-section. So whoever had that question about are some of the same patterns that you see in ICD-10 where 1 is right, 2 is left, 3 is bilateral, is there a same sort of pattern in CPT? Yep, here's your one. So if your second and third digit is a 96, and we're only talking in the OBGYN area, yep, then you know that you previously had a delivery that was a C-section, but today you're going to try to go naturally. You may end up with another C-section, but we're going to try. We're going to try to go that way. But it could equal, it's a combo code. It could end up with another C-section again. If you've not ever had a C-section and you are doing a natural delivery, and you've always done natural deliveries, then you always have a 94. So let's just look for the outcome of this delivery and see what happened at the end. There you go. So that gets you to knowing that C's out the door, right? Now, how would you code twins being delivered naturally? If you've got my notes, then you have the answer written out in front of you, because I have a little chart that I take you through all the little examples, and we just write it in there. You take your test next Tuesday. Wish you luck. Awesome. Coco, you got extra luck because April is my birthday month, and that's when we always have a ton more certification exam testers that pass. Always. It is a lucky month to take your exam. Thank you for the 37,000 taps on TikTok. You guys are awesome. Thanks for sharing the lives. Thanks for all the comments on all the TikToks or the YouTube videos. It all helps. Keeps me motivated to make more stuff. I keep trying out new video editing software. I'm trying to find something that I can actually use and make them better, because I know I'm really awful at video editing. My skills really have not improved any at all in the 5 years I've been making videos, and I'm trying to find something that an old person like me can use and improve their video quality, but I know they're pretty crappy, but I'm trying. So thanks for the comments on the videos. Just Relax says it's 409. Which 409? We've got B that is has a 409 in it, but also D has a 409 in it too. I'll grab you guys the rationale for this one, because I figure some people may go like, what? The answer is B for this one. And here is the rationale for that one. So when you have twins and they're both born vaginally, and the doctor does the prenatal care, and we'll also do the postnatal care. There you go. We will use our multiple modifier to let them know that yes, we're using a parent code and a child code. You know, they're both underneath the same header, and we got to tell them there's a reason why, right? We've got the twin delivery. These are not each codes. They don't have the word each inside them, so we can't do the times. Good job. Good job, Estella. All right, let's look at the available answers we've got here. Let's see. We got two that are 8, 9, 40. And they both have the same diagnosis codes. And then this is an 8950 and an 8720, so they're not even close. So let's go see what our differences are between, and our headers are for the 8940 and 43. I like those two just because they're similar. 8940, 589, 589. Ooh, hot flashing. Lord. Whew. Hits you like a ton of bricks, where every little thing just feels all sweaty all of a sudden for no reason whatsoever. All right, and I'm in a house that's like 68 degrees right now. It's crazy. All right, 589, 43. It's not fun. All right. That's a child code, can't do nothing with it, but the 40 is our mama code. That is an uberectomy, partial, total, unilateral, or bilateral. And then the 43 just adds any kind of lymph node biopsies or anything else to go along with it. So we're under the red header of ovary and excision. If we're dealing with answers B and D, we're doing ovary and an excision. Sorry, guys. We definitely did the removal of the ovaries. This one should be easy. Indeed, indeed. What do you guys think on YouTube, guys? I know I got like almost 40 of you guys here. Whew. Funny story, I used to be a registration for a GI clinic, and in the notes it said incarcerated and nothing else. I was so confused as to why this free patient was marked as a prisoner. Oh, doesn't it sound just terrible? I mean, could they have not come up with another word for that, right? That is a great story. Has anybody been watching the Pit, the show on Max? I had to get Max so I could watch my zombie show, The Last of Us. You know, it finally come out with season 2. So while I have the subscription to Max, of course, I went in and watched the pit this weekend while I was doing notes for classes and stuff. And that's been pretty funny, listening to their medical terminologies and stuff. They're pretty accurate. This one is B. B is your answer for this one. Good job, everybody. This one wasn't bad. They had clear language that matched exactly what was in the CPT code descriptor. This was great. Easy question. Unlike our other one where we were dealing with blocks in other areas and they barely mentioned the part that they were working on, and then they came up with fancy terms to say that they were doing an incision. That is crazy. All right. Get rid of this. And you know a lot more than you think you do when you look at these questions. Are we dealing with diabetes, cardiovascular disease, right? Are we dealing with an OB patient or a status like history of whatever, here for a wellness exam? All you need to know is those different chapter headers, and then look at your question and see what the final diagnosis is. And a lot of times with these, you don't need to even open up the book. I had to watch the pit in small increments. Oh yeah, I did too. And in fact, I did it while I was working really hard and kept it in the background. I can't watch emotional stuff like fully invested. I like to watch action adventures when I put my whole heart into watching it. I let it play in the background and didn't even watch the screen. So it was just listening to the verbiage is what I was doing. Because I get my heart set. And then it reminds me of my patients that I've lost or clinical cases I was in on that still haunt me to this day. Yeah. I will never forget my little Halloween guy. He used to dress up as spaceships and airplanes, and he had polycystic kidney disease. Him and his brother, it's genetic, you know, and he was the baby brother. He was the one that passed away while his mom went on her very first only vacation she's ever had since either of the boys had been born. It's crazy. Never will forget him. I can still see him to this day. So, yeah, the pit is rough. But it's good, but it's rough. But, yeah, I don't watch that kind of stuff wholeheartedly. I let it play in the background. Everybody got this one? Is D right? The gestation is the Z3As. We're not talking about them being pregnant. We're just talking about how many weeks they are. And that is a status code. And that is the Z3A. You know you had, it was either C or D because they're both dealing with OBGYN. These two had nothing to do with pregnancy. And so if you notice the weeks word, your weeks is always done with that code. I'll be back in a couple of minutes. No worries. Oh, Jen, yeah. My little man. My little man. Still see him. Just a little 3-year-old man. He's a little bitty. He was big because the steroids chunked them up, you know. It's too fun. All right, we've got 2 that are in the 83s and 2 that are in the 93s. What is our differences between those sets of codes? You always remember your good things too. The first baby I ever delivered wasn't even supposed to be. I didn't even have hospital rights to deliver yet, and I delivered one. I was just in between the clinic and the OB and delivery, and I was in the office clinic, and doc asked me to take his patient to OB and delivery, and he'd meet us up there. We didn't make it. She delivered that girl before we made it over there, because the clinics were attached to the hospital wing, but we didn't make it upstairs. She delivered a little girl named Michael. She was told, like my dad told me, that when I was pregnant, he didn't care if it was a boy or a girl, it had to be named after him, and it was going to be Michael. That's what mine told me too. So all three of my sons have the name Michael in their name. Kind of like the George Foreman of Michaels. You know, they all have at least that name in there. It's a good thing I had all boys, though. 644, 83, and 93. Go there. We are dealing with spinal issues, right? What is our header differences between the 93s and the 83s? The 93s are dealing with paravertebral spinal nerves and branches. The 83s are dealing with the somatic nerves. This is one of the ones where you need to look for black headers along with your red and blue headers. Be sure to look for your black headers that go along with these codes. Another thing that is helpful is to look at your mama codes. For your 64484, your mama code is 64400. For your 64494, your mama code that you have to look at is your 64490. Oops. Be sure to look up those differences first with your black and blue headers. They're all under the same red header. Same red header. But they do have different black and blue headers. Keep those headers in your head and only look for those differences here. Drop my page. Alright, 64400. These codes will definitely be in the exam. Are we doing an anesthetic agent or a steroid? Or are we doing a diagnostic or therapeutic agent? That is our differences between our parent codes. This one is diagnostic and therapeutic, where this one is steroid and what? Anesthetic or steroid. Why are we doing this? And what are we doing? Are we just numbing them up, or are we fixing them? Also, another thing that you need to know is you can see that they're saying multi-level here. It's propaganda. Your spinal column, you know, starts out with cervical, thoracic, lumbar, and sacral. If you think about it like ladder rungs, it's a little bit easier, I think, to think about how many levels. You have to go up a level to be able to build a level. So if we're doing L5 and S1, that's just one rung on our ladder. If we were doing L4 to S1, that's 2 levels. That would be 2. But the way they have it now with the L5 to the S1, it's only 1 level. Even though they're trying to give you some propaganda here, we only did 1. You go by this number, not by what they're saying up here. These codes are inherently usually bilateral, right and left side, up and down side, dorsal, whatever. It just means the whole thing, you know, up, down, and around, whatever they're doing. I have a lot of coders ask my advice. They're working in spinal offices and they're getting denials on claim because they're adding bilateral or unilateral or whatever modifiers on them to say that they've done right and left side, or they'll only do the left side one day and then come in and do the right side the next day. Well, it's all included in one code. So if you're going to bring them back on a second day, that's free of charge. You've already been charged and billed for everything for that one level, whether you're doing north, south, east, or west side of the thing. So just so you know. But for our exam, they will ask a question probably on this, and to know that L5 and S1 is just one level is handy dandy. They won't get too fancy on you. They just might go from the bottom of C to the top of thoracic. They'll always pick one of these that's ending and one of them that's starting, and in general it's always just going to be one code, one level. And since we are fixing something, our answer is D. Everybody got that one? Good. All right. Can you guys figure out what the answer is with this one? Let's see. We've got right wrist. Well, you know right away we can get rid of the 2 L's, the LTs. Then it's just a difference between these, and they are going to be under totally different blue headers and probably body parts, right? The 47 is probably pretty far away from the 98, so those might be different body parts. So which one's under the wrist? So if we look at our 647, what body part are we under? 64721. Body part is not on that page, but we're under sympathetic nerves, peripheral nerves, extracranial, peripheral nerves, and autonomic nervous system are 298. is going to be way over there in our musculoskeletal section. We can check out our procedure and see what we did. It's probably a case. What did we do? We incised a ligament proximal to the distal, decompressed it. We found the nerve had been flattened. And then we closed them up. Yep. So what do you guys think is your answer? A indeed is your answer. And a lot of times, you know, inside of our exam, it will bundle all the 6,000s into a set of questions. And if your question has 2 from musculoskeletal, you know you can get rid of those, right? And it'll have all the 5,000s bundled into a set of questions of 6. And it'll have all the 4,000s, same thing. And if you know you're in that bundle of 6,000s and you get this question, you can do this one without doing anything other than looking at that one word, because you know you're in the 6,000 bundle set of questions, and the only 2 answers in the 6,000s are these 2, and this one has a left in it. Get rid of it, pick the right, and move on to your next question. You can do this one like in 15 seconds and move on. Don't linger when you don't have to. All your radiology, all the 7,000s will be in one bundle. Your medicine section will be all in one bundle. So if you're playing around with the practice exam questions inside the aapc account, those show up inside an internet browser that says Scorpion. That's the same practice area as this real certification exam. So knowing how to look up where those bundles are is super handy dandy, for sure. Alright, we've got 2 of them that are in the 6-7 area. What's our differences between those 2 codes? Because the other 2 are kind of far away. So 767, 76700. We are doing abdominal or limited. So this one is a complete, and then this one is just limited. So let's see what we did today. If we're doing an ultrasound of the gallbladder for gallstones, where would we be? Are we going to do the abdominal ultrasound, or are we doing limited? And I think the question on the exam is like spleen and gallbladder. It does 2 organs. So it's kind of similar to this question, but a little different. D is correct. Good job. All right, what do you guys think about this question? What are we dealing with here? What kind of pathology are we working with? I hope not. I hope the internet isn't lagging. I am streaming this on YouTube through OBS, which is a more wired in to the internet service, because that's going direct from my desktop computer, which is hooked up to fiber optics, where this one through TikTok is going through my cell phone, and you know how cell phone service is. Blah. I can't even get phone calls on my cell phone. Not from this house, but I can, you know, when I'm out and about. Just not technically here at the house. I don't know why. I think my Wi-Fi is competing with my cellular service and all that other stuff. It's usually mine, even though I live in the city. I know, it's crazy. It's why does your cell phone service never work at home, but it works out and about in town? I don't know. What kind of pathology are we dealing with? Yeah, and this is pretty easy because pathology is literally inside the answer, right? Easy peasy. A is our answer. What about this one? What do the services in the reproductive medicine procedures section of pathology and laboratory chapter of CPT report? It's in the index if you're not sure. Great advice. B is your correct answer for this one. Services related to in vitro fertilization. Indeed. Ooh, E&M questions. Lord. Y'all got your brain still on? Is everybody still awake? I ain't gonna read a thing because I'm just gonna make it easy for you. You guys tell me what you guys think is the answer for this one. I know everybody struggles with E&M. I refuse to learn it for my certification exam. 100%. I knew what a new patient or an established patient was. And I knew how, if I was given MDM overall, what the answer would be. And I think I knew a little bit about time, you know. If it's total time was this or that, I could do those. But the rest, I did not even bother. But that was back when the exam was 150 questions and we could miss a lot more questions. Now they've got it streamlined where E&M is more important now than it used to be. I know, everybody hates this part, but I'm going to make it easier for you. First thing you do is still look at your available answers. Think about your differences, new, established, preventative, or office consultation. Then you read the last sentence, always with E&M. That is the proper protocol. Go to your answers first. Think about every single answer. We don't do the process of elimination with those or look for similarities. Don't do none of that. Just look at A, B, C, and D and think about the differences between those different guidelines that would go along with it. A is for established, B is new patient, C is a consultation, and D is preventative. That's all you need to know. Then you always, on the E&M questions, always do not forget this part or you will get E&M wrong. Do not forget to read the last sentence because many people will read all of this stuff and will assume what they think is supposed to be the answer and cut out the last sentence because we don't need it a lot of times in the rest of the exam for the CPT exam questions or the ICD-10 questions or even HIPICs. But for E&M, this last sentence is vital, and this is a really good example of why it's important, because they're not even asking you any dang thing about Dr. A. They're only asking you what you're going to do about Dr. B. So everything else you're going to get rid of out of your head, and you're only going to think about what did Dr. A do. Sorry. Woo, what did Dr. B do? For an office visit to be considered a consultation, you have to have in writing one doctor asking another doctor to see their patient about a tiny item, one tiny little thing about their health care, not everything from head to toe. If they're gonna ask Dr. B to take care of everything about their patient, then they're taking over care and they're a totally new patient. But for it to be a consultation and for you to pick out C here, that means that Dr. A asked in writing for Dr. B to see their patient about one tiny little thing about their health care. One tiny thing. I'm going to take care of their diabetes, their blood pressure, but I want you to take care of their COPD. That's what I mean. One tiny little thing. Dr. B, in turn, is going to see them for that tiny little thing and write a letter back to Dr. A with a letter. And that's the only way you can have a consultation. And you will have to see that inside your question. You will have to see that Dr. B wrote a letter saying, I saw your patient about their lung condition, and this is my recommendation for over the next 12 months. Make sure they're taking this medication for their lung thing, and I'll see them back in 1 year. It's just to give them advice on how to treat a patient that they're already taking care of for other things, but advice on something specialty. Okay, so if you don't say a letter going back to Dr. A about their patient, about a condition that this doctor doesn't take care of, then this was never a consultation, ever. And if Dr. A says, I want you to take care of this patient, I don't want to see her again, you take over care, she's a new patient for that doctor. She's never a consultation, because that doctor isn't going to write Dr. A back and say, yeah, she is a pain in the butt, but thank you for giving her to me. That just doesn't happen, you know. So the only way it's a consultation is if advice is asked and advice is given back. And that is a rarity that it ever happens on the CPC exam. Most patients ever on the CPC exam are just a new patient. But technically, if Dr. A is covering for Dr. B, that means they are both the same specialty. Same specialty. They're both family practice. They're both cardiology. They're both whatever, because Dr. A and Dr. B are the same specialist in whatever field they're in, and they can see each other's patients. Whether they're new or established, it doesn't matter. So just because a patient is new to Dr. B doesn't mean anything, because he's seeing them for Dr. A, who's already seen the patient. We can't bill more just because this one's gone to Tahiti with his wife and kids or something, you know. So it's just still an established patient. Always and forever. No one ever gets a consultation. Does somebody have a TikTok name as Poop? That is too cool. The kids would be giggling. I saw them jump in. All right, let's do another E&M question. What do you guys think is the answer to this question? Now I see. That's awesome. Relax. Must be a referral. Yep. First thing I see is that we have 2 that are CPT codes, A and C, and 2 that are HIPPICS codes, B and D. What's the one word we need to look for in the question to decide whether we're billing CPT or HIPPICS? It's basically all this question is asking is to know whether you know whether we can bill HIPPICS for this patient or if we're billing CPT. Good job, relax. Yep, if you see Medicare, you know their preferred way of billing is not CPT codes. They bill out of HIPPICS. So it's just a difference between these 2 codes. Are you doing an 0027 or an 0102? Good job, Island. Indeed, D as in dog is our answer. Good job. All right. What is our headers to all of these codes? What is A's header? What is B's header? What is C's? And what is D's header? I just want the headers. A equals what? What are you thinking when you see that code number? There goes cell phone signal pausing again. Admit, not initial. Admit, hospital. $99231 equals what? What's its header? Subsequent hospital. Yep. What is our 238? Nothing means admit and discharge all in one. We don't have that one. Technically, I guess A does, but only if they're Medicare. There's always so many darn rules. 238 is what? Discharge. Perfect. And then where are we at if we're 283? We're in the ER. Good job, Jack. So, what is significant about the ER versus A, B, and D? A, B, and D are all hospital charges for inpatient services, where the ER does not mean you're in the hospital. This is just like being in a regular office visit in a doctor's office. It's an outpatient office visit. It's like you're free to go, where the 21, 31, and 38 are all hospital related charges. These ER just means you're in an outpatient setting. So that is significant to know that difference too during the exam. Now, what are we going to go do? Now that we've looked at every available answer, thought about its importance and the differences, we're going to go do what? Just having internet issues, sorry. Read the last sentence. Good job, Mocha Latte. Good job. Let's go read our last sentence, because they may have a bunch of garbage about their admission, their subsequent visit, their discharge, but then they're only asking us to bill the outpatient ER visit. You never know. They put a lot of propaganda into these notes, in these questions. Ignore it all and go to the last sentence. Find out what in the heck they're wanting you to bill for. So this one says only billing for the day 12/20. So anything that happened on the 17th, we don't need to know about. The 18th, the 19th, we don't need to know none of that. What happened on the 20th? What happened on the 20th? I make these questions way too easy for you guys, but please practice your E&M questions the exact same way. Go through your available answers. Go look at those red and blue headers that are right above the code set. You don't need to read 99221 and read that whole silliness that says initial hospital inpatient visit, straightforward, low level, blah, blah, blah. Don't read all that. Go back to the red header, which is above the code set, which says initial hospital inpatient care. That's all you need. The 99231, don't read subsequent hospital, inpatient, blah, blah, blah. Just know their header. and then read your last sentence. And they will be this easy when you're without me. So what happened on the 20th? They were discharged from the hospital on the 20th. There's only one answer that is a discharge from a hospital. And it's not D. The D has nothing to do with hospitalization at all. C is our only discharge. These two are admits or admission related codes. This one isn't even an admitted hospital code, that's an outpatient code. And the only discharge is that one. Yep, yep, yep. Good job. C is it. C is correct. Good job. Perfect, guys. I hope this was super helpful. I will be back and we will do 2 more hours of free live lessons on Friday. We'll also have a free 3-hour mock exam on Saturday at 2 o'clock. So we'll have 2 days back to back with me. It's totally free, so I hope to see you guys on Saturday. I've already got the questions, I think, done. I just need to format them on the page so that you can see one question per page. So I had this quiz maker make it for me so that I don't have to go find the questions. I put them all at a difficult level so that they're all difficult questions, and we'll see how it goes on Saturday. I hope that's going to be super helpful, but I'll be back about the same time. We'll do 5 o'clock Arizona time zone. It is 7 o'clock now, so we'll do 2 hours just like we did today on Friday. Wednesday I've got a class to teach, and I have one to teach on Sunday too. So busy weekend this weekend, the last weekend in April, but moving on to May. This was your first time, baby girl? Oh, I'm so happy you found me. So we do free live lessons Mondays and Fridays. I just missed last Friday due to a bad pizza I got a hold of on Wednesday. My stomach was not happy with me. Still on Friday, so I missed it on Friday. But I try to do them Mondays and Fridays. And then Wednesdays and Sundays I teach for the course. But we've got a bonus one this Saturday where we're going to do a mock exam for the certification exam, and it's totally free, and it will only be on YouTube. So be sure and join in on YouTube, because I won't stream that on TikTok. It's too chaotic as it is, because we're trying to do them in 120 seconds per question, and I'm trying to do them just like I would if I was doing the certification exam, and I can only keep up with one chat. So we'll do that on, and I barely keep up with that, so we'll do that on just YouTube. So hope to see you guys there. Be sure and hit the subscribe button on YouTube. It's totally free, and it'll alert you when I go live. If you change the little bell settings on YouTube to always, then it'll let you know when I go live, and it's free. 2 o'clock, 2 p.m., which, I don't know, it's 7 p.m. here in Arizona right now, so that should tell you what time, your time, will be 2 p.m. in your time zone area. Welcome to the channel. I hope to see you guys. Don't forget to check out my website. There is so much free stuff there on the website, stuff that you guys can play around with. If you do go to my website at medicalcodingbyjen.com, it has, let me try to get rid of some of this freaking red lines. Okay, underneath the resources tab, you have to join the website, but I'm not going to spam you. I don't think I've sent anybody an email all week long this week. I've left y'all alone, but you go to the social media tab, you can go to the CPT book prep page. It's totally free for everybody. It has 8 pictures. It tells you what to do, including anatomy and ICD-10 on how to make your own notes, just like I do, prepping for your certification exam. You can go to the social media tab and go to the videos for the CPT book prep videos. And I've got 3 videos on how I do the digestive system, all for free for you guys. Check them out. Underneath the resources tab, there's also FAQs, the social media links. Social media links get you to the Pinterest, the Facebook group, the YouTube group, LinkedIn, my Amazon list as far as what pens do I use, what books do I order, what highlighters do I use, how do I build my Lazy Susan, all that kind of stuff. Red Note is there if Tiki Talk ever goes away. Twitch is there too, and our Discord study group link is right there. If you click on that join now, that's how it will toss you into our Discord study group. All totally free for you guys. If you wanted to sign up for one-on-one tutoring or a mock exam, you can do right there for tutoring with a mock exam. If you just want to ask my advice on stuff, you can do the second one. If you already have a CPC course, you have to have the course and current access to it right now, and you want to add me as your instructor, then you can do that. Or if you want to purchase a course from me, which you do not need a course, you can do the self-study, but if you're insistent and you really want to buy a course and you really want that structure, then we have a new course going to start like in August. You can go on and purchase here, and there is tons of financing there, just tons of different, if you need help paying for that, there's tons of stuff there. Don't forget about Pocket Prep, guys. It is great. This is the way you can access 750 practice exam questions on Pocket Prep. If you use my link, I do get like $4 from them just because you use this link. You click on medical, and the very top link is aapc CPC. And you click on that, they have access to 750 practice exam questions, all in all of the 18 areas of the exam, including cases. They do have a pass guarantee for you. If you purchase 3 months of access and you don't pass, they'll give you another 3 months for free. Really kind of cool. They even come with answers and page numbers where the answers are. Have the questions changed yet, guys? Have you guys noticed? I know every April they update them. So I know they're going to come out with new questions pretty soon. So if anybody's ever done any of all 750 questions, then they are due to update. It's really cool because you get to take these questions with you wherever you go. They are exactly like what's on the exam. And they do cover all 18 areas, and you can put it on your phone and you can do the question of the day. You can build a quiz and do just nothing but E&M questions, or do all cardiovascular, or just your top missed questions. It's really cool. I like Pocket Prep. I have them purchased. I purchased a whole year at a time, and that way my price ended up, because I paid for it in advance for $95, and I got a whole year access, was only $7 a month. So I just paid for it for a whole year. But I love it. I love it. Pocket Prep. Another place you can go to is, I do have a free practice question area, which is labeled free practice area. You just click on it and you can go there. You've got free PDFs you can instantly download right there. There's that word search that I had up. You can just click on the question and see if you got it right. It instantly pops up with the correct answer and rationale. There's a bunch of practice questions and other stuff that you can download from that page. 2, there's a free blog that also helps you out with job resources, and including medical coding resources. So like if you wanted to know how to code infusions or E&M, there's a a 9-chapter book on E&M there too. I have a lot of blogs that I write for lots of different areas of the CPC exam or CPCO exam. I draw pictures, do all the kinds of stuff. There's practice exam questions in these blogs. They're free for you guys to read and learn up on, whatever you guys want. Super helpful. I do have some memberships for practice exam questions for like $8 a month. If you wanted to access practice exam questions that I wrote, you can purchase an $8 membership and you can come here and do more practice exam questions just in those areas. And pretty cool, pretty cool. I've been trying to add more stuff to it. Like you've got more anatomy stuff here in the cardiovascular area. E&M questions were updated. There's a lot of stuff in here. There's the heart. You can match up with body parts. There's a patient's chart you can add vocabulary to. Some flashcards. All kinds of stuff. More anatomy that you can do. And a ton more practice questions. And bonus PDFs that you get to download on the side. All those are free. They're not my notes, but they're still free PDFs that you get to download of cool stuff, all dealing with cardiovascular if you wanted them. And you can redo these questions over and over again if you wanted to. If you're doing risk adjustment, CRC, I have its own set of questions, and then if you're doing Practicode, I have its own set over here if you need help with Practicode. So tons of things for you guys to do. The shared gallery over here to the side is also all of my favorite pictures. It's totally free for everybody, so you can come here and you can see all my favorite anatomy pictures. What pens do I use? Time zones, just all kinds of stuff. My favorite anatomy pictures, as far as how to make your ICD-10 notes, or my brain pictures, what notes I add to those sections. Even modifier notes are all listed here for you. My website just holds information for you guys, so it's mostly here for free for you guys to play around with. Don't be afraid of my website. Be sure and come here and hang out, and also hang out in our Discord study group. It is super handy dandy. Go-Kart and Twinkle are always in there. If you do join our Discord study group, it is cool because it has tons of rooms for you guys you can join in on. And as soon as you join my main room, which is Medical Coding by Jen, that's our main chat room, I've got all these other rooms for you, like where do I start? That's a list of all my favorite videos posted there. Then we've got what to expect on exam day, CPC practice exam questions, cases, E&M resources, all the way down. Tons and tons of rooms, anatomy rooms. You can see who all we've helped. We've got 2 rooms for job resources, Practicode resources, CEU resources, study buddies. If people are selling their books, they're in here too. I don't allow people to sell on Facebook because people get hurt in there sometimes. So I think it's better in our Discord study group because we know everybody in there. But just tons of help no matter what you've got going on. Even ICD-11 stuff, CIC, you name it, we've got a room for it in our Discord study group. And this is totally free for you guys. You just scroll backwards once you go into a room. If you want to see any resources, you can also type in like any subject that you're looking for, like camera, whatever. Like if you want to know what camera to use for your certification exam, just type it in and it'll bring up every conversation anybody's ever had with the word camera in it. And then you can see what they gave you a link for. Pretty cool. But don't forget about the Amazon list. It's got everything that I literally have here on my desk. Everything. From the mouse to the keyboard to the pens and highlighters that I use, and how I keep my books from unraveling, what I'm using here, my little mushrooms and stuff. So it's all listed there in the Amazon list too. So super helpful. And if anybody wants to join in and add me as an instructor, or I have tutoring available, I think next week. I think all I've got is one more person scheduled for this Thursday, and then nobody else is scheduled afterwards. So if anybody's looking for advice or tutoring, I have that open. But I hope this is all helpful for you guys, and I hope to see you on Friday and Saturday for our live free mock exam too. I hope this was helpful. Thanks so much for the gifts. Wookie, oh no, I am a huge Star Wars fan too, so that is awesome. I love your name. I remember being too afraid to ask for an Ewok when I was a kid, because I knew, you know, my parents weren't, you know, they're middle class, but they were struggling too. So, but that was a one movie my parents both took me to, and that had a really big impact on me because we didn't go to the movies, you know. We didn't do that. My aunts or uncles might take me to the movies every so often. My mom had siblings, but my parents never took me to the movies, but they took me to Star Wars. So I became a good Star Wars fan. I love it. You're an Ewok lover. Aw, love it. I remember always wanting one as a kid, but too afraid to ask for one. But it was cool. That was the good old days. Love it. They're coming out with a new Star Wars. Gonna be out in 2027, so I'm excited to watch that. So that'll be out pretty soon. They've already announced whoever the actors are. Don't know. But that just came out just this week, so yeah. Oh, look, there's my Star Wars blanket right there. Thanks, Twinkle. Anyway, love you guys. I hope this was super helpful, and I will see you guys on Friday and on Saturday. Hope you've gone to Disney. That is the best ride ever. That was worth a $100 price ticket just to get into the park, right? To go to do the Star Wars interactive ride. It's like you really are, because you end up on one ship, and then you walk off and get on another ship, and then you walk off it, and then you end up inside a concentration. I mean, you just end up, yeah, that was cool. That was cool. That was cool. Yeah, the Millennium Falcon was cool too. Yep, that was awesome. I love them both. I love both the rides. Yep, love it all. I'm going next year. Travis, if he's picked for varsity team cheer for his 11th grade year. Can you believe my baby is going to be in 11th grade next year? And next year, I mean August. Oh my gosh. My baby Travi. So if he's in varsity cheer, because he's junior varsity, he didn't get to go to Disney. But if he's in varsity this year, I get to go to Disney. I'm so excited. I can't wait. I want to go back again. I haven't been in probably 5 years, so that'll be fun. All right, love you guys. I will see you on Friday, and if you're my student, I'll see you on Wednesday. Good night, guys. Oh, I hope that was helpful.